In the past few years, children's palliative care in Bangladesh has made remarkable progress. In 2016, with the support of World Child Cancer, supporters of children's palliative care in Bangladesh began working together on a special project called the Children's Palliative Care Initiative in Bangladesh. This project had a vision to ensure palliative care for every child who needed it. In Bangladesh, there are an estimated 6,000 to 9,000 children who develop cancer each year. Many of these children are not able to access curative treatment due to financial barriers and false beliefs among healthcare providers and the general public that cancer is incurable. For children who reach hospitals and are diagnosed with cancer, almost half are not able to complete the recommended treatment due to the financial burden for their families. Many of these children will need palliative care, but it can be very challenging for them to access this essential care. We know that palliative care can be very helpful for children with cancer. Providing palliative care ensures that children's pain and other symptoms are addressed, and this type of care is actually considered to be an essential component of pediatric cancer care in all settings, including settings where resources are very limited, such as low and middle income countries. When the Children's Palliative Care Initiative in Bangladesh started, we identified 3 significant barriers preventing children from accessing palliative care. The first was that there was poor public awareness about the importance of palliative care and how it could help children with cancer. The second barrier was a lack of knowledge and skills in palliative care among healthcare professionals. And thirdly, there were very few palliative care services that had been developed at local healthcare facilities. Since 2016, the Children's Palliative Care Initiative has developed and implemented a number of programs to address these barriers and improve access to essential palliative care for children. Because of the lack of awareness about palliative care, as part of the Children's Palliative Care Initiative, we implemented awareness programs on palliative care for patients and their families, as well as members of the local community. Additionally, we conducted awareness seminars for doctors, nurses, and other healthcare professionals, focusing on hospitals where children with cancer receive treatment. These events provided basic training to help healthcare professionals understand the need for palliative care and what was palliative care. Once healthcare professionals were sensitized to palliative care, they were provided with more in-depth training to develop their knowledge and skills. More than 2,000 healthcare professionals, including doctors, nurses, pharmacists, physiotherapists, psychologists, social workers, palliative care assistants, and counselors, participated in palliative care training programs as part of the Children's Palliative Care Initiative. These programs were focused on training healthcare providers to have the knowledge and skills to be comfortable and capable to provide palliative care for their patients. Training was focused on management of pain and other symptoms, as well as communication and providing emotional support. We were fortunate to be able to engage with trainers from India, South Africa, New Zealand, Portugal, Singapore, the United States, the United Kingdom, and Canada, as well as many local experts in palliative care who came together to help deliver these training programs. After completing training programs, we continue to support newly trained healthcare professionals through mentorship and additional training to help them make practice change. Project ECHO has been the way in which we've been able to provide additional mentorship. Project ECHO is an educational model that connects community-level healthcare providers with specialists. ECHO uses a hub and spoke design where a team of experts at the hub is connected with multiple participants for regularly scheduled education sessions. ECHO has been particularly effective in Bangladesh, since it emphasizes moving knowledge, not people, having the training reach the healthcare professionals where they are, instead of requiring them or their patients to undertake long journeys to specialist centers to receive training or care. In each ECHO program, the structure varied, but there were usually between 7 and 26 sessions where participants were able to join up with video conferencing and discuss challenging clinical cases and learn together. Sessions were archived after being recorded, and participants were able to access the recordings, slides, and other resources at any time. We know that this supported future and further learning. Many participants went back and rewatched videos or shared them with their colleagues, or used these resources to teach their local teams. Healthcare professionals who have received mentoring through the Project ECHO model have now gone on to be recognized as leaders and mentors in the field of palliative care in Bangladesh, and are providing mentorship for other healthcare providers who are just starting on their journey in training in palliative care. I want to highlight the Nurse Leadership Program. Recognizing the important role that nurses play in the healthcare system, particularly in providing palliative care, the Children's Palliative Care Initiative included a specialized nurse training program. This program involved developing a palliative care nursing curriculum as well as a Train the Trainers program. This supported nurses to become palliative care experts and trainers. The program was very successful, with more than 200 nurses participating in the program. The Children's Palliative Care Initiative also recognized the importance of direct support for patients and their families. Over the past 5 years, the program supported awareness sessions for parents, where parents could receive important information about cancer, pain management, and supportive care from a trusted member of their child's healthcare team. Additionally, welcome packs containing toys, drawing materials, and practical personal care items were distributed to children admitted to pediatric cancer wards. Play and artistic expression are very important activities to support children emotionally when they are facing a serious illness such as cancer. So art and drawing competitions were organized, as well as other supportive activities for children to engage them in the program. The awareness and education events of the first few years of the Children's Palliative Care Initiative led to the development of 6 new palliative care services for children, as well as the integration of palliative care into children's cancer treatment wards at hospitals where children with cancer were treated in Bangladesh. You can see some images here of these new programs, including the palliative care wards at Dhaka Medical College, Dhaka Shishu Hospital, and Bangabandhu Sheikh Mujib Medical University, as well as the program in the Coral slum in Dhaka. We hope that this presentation has provided you with an overview of the successful palliative care activities which we have engaged in over the past 5 years. We are now excited to develop our vision for 2021 and beyond. The Children's Palliative Care Initiative will continue. We plan to continue to develop and expand pediatric palliative care in Bangladesh. We have a network now where we can share educational and clinical resources, develop best practices and standards for palliative care, and disseminate knowledge of palliative care to others both in Bangladesh, across South Asia, and around the world.